Hello friends, welcome to the channel PsychoTech Score 100%. In this video, I am going to discuss about eating disorders, its types, signs and symptoms, risk factors, treatment and therapies for eating disorders. Before I start this video, let me share a fact related to eating disorder. You will be amazed to know that eating disorders affect several million people at any given time, and most often women between the ages of 12 and 35. This has been taken from APA website. So now let us start our video and discuss about eating disorders. First of all, let us discuss what are eating disorders. Eating disorders are basically behavioral conditions characterized by severe and persistent disturbance in eating behavior and associated distressing thoughts and emotions. Further, eating disorders can be very serious conditions which may affect physical, psychological, and social functions. After this, let us discuss the types of eating disorders. Basically, there are three main types of eating disorders. First, anorexia nervosa. Second, bulimia nervosa. And third, binge eating disorder. Further, there are some other types of eating related disorders, which includes other specified feeding and eating disorder, avoidant or restrictive food intake disorder, Pica, and rumination disorder. So now let us discuss each types of eating disorder in detail. First of all, let us discuss about anorexia nervosa. Anorexia nervosa is basically characterized by self-starvation and weight loss resulting in low weight for high teenage. Anorexia has the highest mortality of any psychiatric diagnosis other than opioid use disorder and can be a very serious condition. If we talk about the body mass index or BMI, which is a measure of weight and height, is typically under 18.5 in an adult individual with anorexia nervosa. It is also important to note that dieting behavior in anorexia nervosa is driven by an intense fear of gaining weight or becoming fat. Although some individuals with anorexia will say they want and are trying to gain weight, their behavior is not consistent with this intent. For example, they may only eat small amounts of low-calorie foods and exercise excessively. Also, some persons with anorexia nervosa intermittently binge eat and or purge by vomiting or laxative misuse. There are two subtypes of anorexia nervosa. First is restricting type, in which individuals lose weight primarily by dieting, fasting, or excessively exercising. And second one is binge eating or purging type, in which persons also engage in intermittent binge eating and or purging behaviors. If we talk about the symptoms of anorexia nervosa, over time some of the following symptoms may develop related to starvation or purging behaviors. And these symptoms include menstrual period cease, dizziness or fainting from dehydration, brittle hair or nails, cold intolerance, muscle weakness and wasting, heartburn and reflux in those who vomit, severe constipation, bloating and fullness after meals, stress fractures from compulsive exercise as well as bone loss resulting in osteopenia or osteoporosis, that is thinning of the bones, depression, irritability, anxiety, poor concentration and fatigue. So these are some of the symptoms which may develop related to starvation or purging behavior in anorexia nervosa. The risk factors of anorexia nervosa include serious medical complications which can be life-threatening and include heart rhythm abnormalities, especially in those patients who omit or use laxatives, kidney problems or seizures. Now let us talk about the treatment of anorexia nervosa. Treatment for anorexia nervosa involves helping those affected normalize their eating and weight control behaviors and restore their weight. As a medical evaluation and treatment of any co-occurring psychiatric or medical condition is an important component of the treatment plan. Likewise, the nutritional plan should focus on helping individuals counter anxiety about eating and practice consuming a wide and balanced range of foods, different calorie densities across regularly spaced meals. For adolescents, the most effective treatment involves training parents to support and monitor their child's meals. In anorexia nervosa, addressing body dissatisfaction is also an important, but this often takes longer to correct than weight and eating behavior. In case of severe anorexia nervosa, when outpatient treatment is not effective, admission to an inpatient or residential behavioral specialty program may be indicated. Last but not the least, most specialty programs are effective in restoring weight and normalizing eating behavior, although the risk of relapse in the first year following program discharge remains significant. After anorexia nervosa, the next type is bulimia nervosa. Individuals with bulimia nervosa typically alternate dieting or eating only low calorie, that is safe foods, with binge eating on forbidden high calorie foods. So, what is binge eating? Binge eating is defined as eating a large amount of food in a short period of time, associated with the sense of loss of control over what or how much one is eating. And binge behavior is usually secretive and associated with feeling of shame or embarrassment. Further, binges may be very large and food is often consumed rapidly beyond fullness to the point of nausea and discomfort. Binges occur at least weekly and are typically followed by what are called compensatory behaviors to prevent weight gain. These can include fasting, vomiting, laxative misuse, or compulsive exercise. As in anorexia nervosa, persons with bulimia nervosa are excessively preoccupied with thoughts of food, weight, or shape, which negatively affect and disproportionately impact their self-worth. Also, individuals with bulimia nervosa can be slightly underweight, normal weight, overweight, or even obese. If they are underweight, however, they are considered to have anorexia nervosa, binge eating, or purging type, and not bulimia nervosa. Family members or friends may not know that a person has bulimia nervosa because they do not appear underweight and because their behaviors are hidden and may go unnoticed by those close to them. There are some possible signs which can help to identify that someone may have bulimia nervosa, and these signs include frequent trips to the bathroom right after meals, large amounts of food disappearing or unexplained empty wrappers and food containers, chronic sore throat, swelling of the salivary glands in the cheeks, dental decay resulting from erosion of tooth enamel by stomach acid, heartburn and gastroesophageal reflux, laxative or diet pill misuse, recurrent unexplained diarrhea, misuse of diuretics, that is water pills, feeling dizzy or fainting from excessive purging behavior resulting in dehydration. There are some risk factors associated with bulimia nervosa. Bulimia can lead to rare but potentially fatal complications including esophageal tears, gastric rupture, and dangerous cardiac arrhythmias. Medical monitoring in cases of severe bulimia nervosa is important to identify and treat any possible complications. Now, if we talk about the treatment of bulimia nervosa, outpatient cognitive behavioral therapy for bulimia nervosa is the treatment with the strongest evidence, as it helps patients normalize their eating behavior and manage thoughts and feelings that perpetuate that disorder. Also, antidepressant can be helpful in decreasing urges to binge and vomit. After bulimia nervosa, next type is binge eating disorder. As with bulimia nervosa, people with binge eating disorder have episodes of binge eating in which they consume large quantities of food in a brief period, experience a sense of loss of control over their eating, and are distressed by the binge behavior. Unlike people with bulimia nervosa, however, they do not regularly use compensatory behaviors to get rid of the food by inducing vomiting, fasting, exercising, or laxative misuse. The diagnosis of binge eating disorder requires frequent binges, at least once a week for 3 months, and associated with a sense of lack of control and with 3 or more of the following features. First is eating more rapidly than normal. Second, eating until uncomfortably full. Third, eating large amounts of food when not feeling hungry. Fourth, eating alone because of feeling embarrassed by how much one is eating. And fifth, feeling disgust with oneself, depressed, or very guilty afterward. Risk factors associated with binge eating disorder is chronic and can lead to serious health complications, including obesity, diabetes, hypertension, and cardiovascular diseases. Now, after risk factors, let us discuss about the treatment of binge eating disorder. As with bulimia nervosa, the most effective treatment for binge eating disorder is cognitive behavioral psychotherapy for binge eating. And interpersonal therapy has also been shown to be effective, as have several antidepressant medications. So these were three main types of eating disorders. In my next video, I'll discuss some other types of eating related disorders. See you in the next video. Till then, take care. Bye bye.